The big story we're tracking this morning is Omicron, the new variant that has led to a lot of reactions across the world. Well, to talk more about the new variant and the world reactions and what we know so far about this particular variant, we're now joined by Dr. Lawrence Young, virologist, University of Warwick. Thank you so much, Doctor, for joining us on the program. So what do we know about the new variant so far, according to what WHO has said? And by when can we expect, more definite answers?
So most of what we know about Omicron is what we can see from just looking at the virus on a piece of paper, from looking at the genetics of the virus, looking at the viral genome, which tells us it has a unique and very high level combination of different mutations. In fact, it looks like all the other variants we've seen all in one virus. And that alerts us to the possibility, and it's only a possibility, that the virus may be more infectious and may be able to evade some elements of the body's immune system. So we need to keep a close eye, actually, on what's going on in South Africa, where the virus is spreading at a high level. We need to know what's happening with hospitalizations and what's happening with vaccination.
And so far, what WHO has said is that we can't say for certain about transmissibility or severe disease, but they have said that the reinfection risks are higher with this variant.
It's difficult to make too much conclusion about reinfection because we're seeing a reinfection with Delta variant. A lot of this is because whether you've had natural infection or vaccination, after a few months, your immune response decays, it wanes, and you become more susceptible to reinfection, particularly if you are elderly or more vulnerable in the first place. So it's hard to conclude very much about it at the moment. Having said that, it looks like at the moment there's no reports of significant deaths or massively increased levels of severe disease in South Africa. The hope may be that there is some protection from vaccination, but of course South Africa have very low levels of vaccination. Only about 24% of the population are fully vaccinated. So I think it's going to take a couple of weeks actually for us to really learn whether or not this virus is the threat that we're all currently panicking about.
All right, now talking more about the South Africa experience, there is anecdotal evidence from there that perhaps disease caused by the Omicron is milder. There's one doctor who's been quoted in a lot of interviews, and much has been made of this on both sides. What's your view?
I think you need to look at hundreds of patients, and the anecdotal reports, you can take some hope in those reports, but I think we need to wait. There are now over 4,000 cases in South Africa. We just need to give it a few more days. We should know whether or not that's resulting in a massively increased level of hospitalization and death. And what we need to tease apart from the data is who's vaccinated and who's not vaccinated in relation to hospitalizations, and keep an eye also, of course, on where this virus is going around the world.
And let's talk now about the world reactions ever since the news of this variant broke. After the Delta devastation, one can understand that countries are very anxious and being very, very cautious. But at the same time, you have, the WHO, the UN saying all these travel bans is an overreaction.
I can see that, as we say, it's better safe than sorry. And many governments around the world, including the government in the UK, have dithered and delayed responding to previous variants, and I think we're a little bit sensitized to that, and so I can see that there's this reaction. It is a bit of an overreaction. In the UK, for instance, we still have 10 times the amount of daily infections from Delta as compared to the infections in South Africa. We've still got a problem with Delta in this country, and I think some of the things that the government are fast tracking in the UK now, like booster shots, are really just as much a response to the Delta situation as they are to the possible threat from the Omicron variant.
Now, so far in India, we've not, detected any case of Omicron. That's what authorities have been saying. But many of the other countries that have detected cases, like the Netherlands, has said that they had cases from before the news came of this variant, and, flights have been stopped. So what's your view?
Yeah, my view is that once a variant is identified, particularly one that's likely to be more infectious, it would have spread far beyond the original case and the original country. That's the nature of infectious disease when you have international travel. We've seen that with all the other variants, and once you detect it by genome sequencing, it's very likely to be everywhere. And sad to say, I suspect you will find it in India very soon.
All right, so finally, Doctor, what is the upshot of all this? We shouldn't panic just yet. We need to wait for more information before taking, a lot of action and carry on with the best practices to prevent COVID, which is something that we already know.
I think this is a big lesson for us anyway, because it's a sort of a wake up call if we needed it. We are dealing with a global pandemic, and of course, whilst it's the responsibility of local governments to look after their own country, it's in all our interests that we look after other countries too. And by that I mean the equity of vaccine distribution and vaccination. We must get more people around the world vaccinated. Vaccinations will stop the virus spreading and stop the virus mutating. We also need to be wearing face masks and to put into place those other protections that can protect ourselves, our families, our friends, and just as important, our healthcare system. So a lot of this is about not overwhelming our healthcare systems. We have a particular concern this time of year in my country because it's the winter, and the winter months are always associated with more respiratory infections, and this compounds the problem both with Delta and with the possibility of incoming Omicron as well. So I think it's all in all our interest to be cautious. Vaccination will have an effect in stopping the spread of the virus. We believe that vaccination will protect from severe disease, even with this Omicron variant.
All right, Dr. Young, thank you so much for speaking to us here on the program.